Welcome to the place where brains collide with science, wit, and a nerdy vibe. I'm Dr. Angel. Let's dive in where psychology meets a clever spin. Stay curious, be kind, and keep your mind nerdy.
Anxiety, panic, and depression. What are they? What are they not? Hey there, fellow nerds. Welcome back to Nerdy Psychology, the channel where we break down mental health myths and share some cool psychology facts. Well, we also sprinkle in a little fun and quirkiness. May is Mental Health Awareness Month, and today we're going to dive into one of the most common but often misunderstood mental health issues: anxiety, panic attacks, and depression. Are you confused about what these really mean and what they're not? Well, you're not alone. Today, we're going to talk about the science and the signs and the real differences between these three and how to tackle them head on. All right, let's get started. But before we dive in, hit that subscribe button and join our nerdy community. If you want to be notified when our new episodes drop, hit that bell icon and you can get notified. So here's a fun fact. Feeling anxious or sad from time to time is completely normal. But what happens when these feelings take over your life and won't let go? Is this just the blues or is it something more? And what's the deal with panic attacks? Well, spoiler alert, just because you're stressed doesn't mean you're having an anxiety disorder. So today we're going to break down what anxiety, panic, and depression actually look like, and well, what they're not. And well, how to know the difference. So let's unravel this mystery. So, what is anxiety? More than just a feeling? So, let's start with anxiety because, well, who hasn't felt anxious before? If you have blood pumping through your veins, you have experienced the feeling of feeling anxious. And before a job or a change or a vacation or a move or meeting a new person or going to a party, right? Like we can all feel that feeling of anxiousness come to us when we have these things happening. And it's completely normal when we're faced with something maybe stressful or even exciting. I know we've talked about this in other episodes, but our brain can't tell negative things from positive things sometimes when it comes to sending those excitatory hormones. So things that may be great and fun and exciting can still make us feel that anxiousness because it's sending those same hormones through our brain. And so, what happens when anxiety goes too far? Well, when it doesn't just show up before a stressful event, but takes over your day to day life. So let's say you're about to leave the house and your mind is racing constantly. What if I forget something? What if something bad happens? What if I get in an accident? What if I'm late? What if they don't like me? What if I'm not wearing the right thing? What are they going to think about me? Okay, that constant worry, if it keeps popping up for no good reason, could definitely be some of that clinical anxiety. Or if a person who is leaving their house and they go to check their door to make sure they locked it like 2, 3, 4 times, and then they think about it the whole day, questioning, did I really lock that door? That could be that real anxiety. And so the person who feels their heart racing just thinking about social situations, those are anxiety in action. And anxiety isn't just feeling nervous or anxious, it's chronic worry and fear that just keeps you from, well, living your life freely, to be honest. It's a cycle. It can be really tough to break without help. So, anxiety disorders aren't just the typical jitters. It's excessive. It's a persistent pattern that interferes with, well, our daily activities and functioning. So, how do I know if this is normal anxiety or something more? Well, First of all, if you're asking the question, I would definitely recommend asking that to a professional medical person. But the key difference is how persistent is the worry and how much is it affecting your everyday life? Are you the person who sits up and you're overthinking and reliving your whole day all night and you're not getting sleep? And maybe you fall asleep, like 2 hours before the alarm needs to go over because you're concerned and worry about the things that happened the day before or the things that are going to happen. That's interfering with daily function. Or are you the person while you're doing one thing, your mind is consistently in another place worrying about things that could go wrong? Or maybe you avoid doing the thing altogether because what if it goes wrong? I don't want to do that. And so that's what we're talking about, impacting our everyday life. It can be consuming, and those thoughts can just take over in our mind, and they're there if we're at home, if we're at work, if we're doing something fun. Those thoughts can just come up at us at any time. So according to the DSM, which is our diagnostic Bible and mental health, the symptoms of anxiety, and this is not an exhaustive list, but here are some of those symptoms. So it can be things like restlessness or feeling really keyed up or on edge, being really fatigued and tired, or having difficulty with focus or concentration or memory, or maybe their mind's just going blank, or they're irritable and moody. Maybe they're experiencing muscle tension, definitely sleep disturbance. Maybe they have a difficult time falling asleep or staying asleep, or they're just restless all night. These are symptoms that can vary in intensity and duration, but they can all contribute to the overwhelming feeling of anxiety that can disrupt your daily life. If you find yourself experiencing these symptoms regularly, it might be time to go seek some professional help. One of the key things I will say that some people come to me when they may be experiencing anxiety is they might think they have adult ADHD when they've never had a diagnosis of ADHD in their life. And a lot of times, the lack of focus, a lack of concentration, lack of memory, forgetfulness, procrastination, task completion, like all those things that we would put in an ADHD checklist, can also be some of the exact same symptoms of anxiety. And so that is where there's a lot of overlapping symptoms. So anxiety isn't just feeling nervous, it's chronic worry and fear that keeps you from living your life freely. It's a cycle. Panic attacks. When anxiety, hits overdrive. Okay, so now we're going to talk about panic attacks. It's the extreme version of anxiety. If you've never had one, you might think they're just a lot of stress all rolled up into one moment. But panic attacks are way more than just being completely overwhelmed. They can feel like you're having a heart attack, or you're losing control, or you might be feeling you're literally dying in that moment. Imagine you're walking into a meeting or just sitting at home, and suddenly, bam, your heart starts racing, your chest tightens, you can't breathe, you might feel dizzy or lightheaded, and your skin might get clammy, or you might have tingling in your fingers, and you might be thinking, am I going to die, or what's happening to me? That is a panic attack. It's a surge of this intense fear or discomfort that comes on suddenly and without warning. And the crazy thing is, this can happen totally out of the blue, even when there is no immediate stressor. People can even wake in the middle of the night while they're sleeping, experiencing panic attack symptoms. Panic attacks are a bit like your brain hitting the emergency alarm button over and over, and your body and your brain thinks danger, 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 even when there isn't that danger. So, panic attacks are not the same as feeling overwhelmed. They're much more intense. And they usually come with some really specific physical symptoms like heart palpitations or accelerated heart rate, sweating, trembling, shaking, sensations of shortness of breath, can feel like you're choking or you have a lump in your throat, chest pain or discomfort, nausea or abdominal distress, feeling dizzy or unsteady, lighthearted or faint, chills or feeling really hot, feeling the numbness or tingling in our body, feeling derealization, feeling like you're not in reality all of a sudden, or depersonalization, where you feel like you're detached from yourself, or fear of losing control or going crazy, fear of dying. Like these are the symptoms that can occur suddenly, making panic attacks very intense and distressing experiences. If you know someone who's experiencing these symptoms regularly, it might be some time for them to seek professional help. Here's the kicker: a panic attack can happen anywhere, anytime, with no real trigger. And that's what makes them so frightening. Depression. It's more than just feeling sad. Now let's move on to depression, the mental health condition that is often misunderstood. Everyone has moments when they feel sad or down or blue, but when those feelings linger for weeks or for months or even longer, well, when everything feels like a drag and you just can't summon the energy to do the things you like to do or really enjoy doing, depression isn't that feeling of just sadness. It's a pervasive sense of hopelessness and despair, and it can impact every aspect of your life. Imagine waking up every day with a heavy weight on your chest, making it so difficult for you just to get out of bed, or you lose interest in all the things that you really love to do. You're just so tired, you're not sure how to get through your day every day. We're having that feeling of worthlessness that can just make even the simplest of things feel like you're climbing the Himalaya mountains. So let's say you used to love painting, but now the thought of picking up that brush, well, that feels so overwhelming. And you might find yourself withdrawing from your family and your friends. You may find yourself unable to just have social interactions. It's not just a bad day or a rough week. It's a persistent cloud that hangs over you, making it difficult to just see any light at the end of the tunnel. Depression can manifest in so many ways, and it can include things like that persistent feeling of sadness and anxiety or empty mood, that loss of pleasure, the changes in appetite or weight, oversleeping or undersleeping. And again, depression can also give us symptoms of difficulties with concentration and memory and following through with tasks and procrastinations and feelings of guilt and worthlessness. Thoughts of death or suicide are even part of depression. And these symptoms can vary in intensity and in duration, but they all contribute to this overwhelming feeling of depression, and that can really disrupt your daily life. And it's not just in your head, it's real, it's clinical condition that affects both your mind and your body. If you find yourself experiencing these symptoms regularly, it's time to seek professional help. Depression is not just feeling sad, it's a complex condition that affects your emotions, thoughts, and physical well being. The key differences. Okay, so let's just review. Anxiety, panic attacks, and depression can all overlap in symptoms like irritability or feeling overwhelmed, but let's break down what they're not. Anxiety is just not about feeling nervous or concerned before an event or a change. It's excessive worry. It interferes with your daily life and function. Panic attacks are not just this intense stress moment or feeling super overwhelmed. They're sudden, intense bursts of fear with physical symptoms like rapid heartbeat and dizziness. And depression, well, it's not just about feeling sad or blue. It's a persistent low mood that can last for weeks or months. And it can affect every part of your life, from your relationships to your energy to your appetite to what you would do with your day. These are real clinical conditions that require professional help, not just a pep talk or a snap out of it moment. So, how to manage anxiety, panic, and depression? If you or someone you know is struggling with any of these, here are some steps that can help you take control of your mental health. Step 1, seek professional help. Therapy, it's a game changer. Cognitive behavioral therapy is especially effective for anxiety and depression. And if you can identify and change these thought patterns, it can make a huge difference. Additionally, maybe you might need to seek medical evaluation. It's crucial to determine if medications may be what you need to help you manage your symptoms of anxiety or panic or depression. These clinical conditions are highly treatable with proper treatment and protocols and supports and interventions. Step 2, we can learn some of those coping strategies for panic attacks and anxiety. So when we are having those moments, we can take back our power to get through those moments. So things like breathing exercises and mindfulness and grounding exercises can really help us take back our power when those attacks overwhelm us at times. And step 3, we want to develop healthy routines. Routines are so important to all three of these conditions. So things like exercise and sleep and balanced diet can massively impact our mental health positively or negatively. And so regular movement, good sleep hygiene can help reduce symptoms of anxiety and depression. Establishing healthy routines can provide that strong foundation for our overall well-being. Step 4, challenging our negative thoughts. And so when things are happening to us, really being more self aware of what we're experiencing, what we're thinking, and taking note of it and talking to your professional provider about what's really happening. What are those fears? What are those thoughts that are really going through your head in the middle of the night? What are those worries? How are they impacting you? This is the time to be transparent. Remember, anxiety, panic, and depression don't have to define you. And with the right tools and supports and treatment, you can manage these conditions and live your best life. I hope this episode helped you better understand anxiety, panic attacks, and depression and how they differ from one another. If you found this video helpful, make sure you hit that subscribe button and share it with someone who might just need to hear this information. We're on a mission to hit 10,000 subscribers, and we need your help to get there. If you have any questions or, well, you just want to share your own experiences, drop a comment below. And as always, be curious, stay kind, and keep your mind nerdy. See you next week. That's a wrap.
Stay curious, be kind, and keep your mind nerdy.